About 18 to 20% of women in the United States suffer from migraines, and thankfully most of them report that during pregnancy they have less of them than they did before. But about 5% of women who had migraines previous to getting pregnant report that they get worse. Only 2% of women who have long-term migraine problems developed their first migraine during pregnancy. So it's unusual to get your first one during the first trimester or so, but it does happen. If you develop headaches during the first trimester, know that they can be normal because it's due to hormone changes in your body, but they should just be mild and they shouldn't be super persistent or get worse. So if you feel like you're having migraines because you've had them before and know what's going on, call your doctor and they'll decide what treatment would be best for you. Generally speaking, doctors prescribe Tylenol first for it and then go from there if Tylenol isn't helping the issue. If you've never had a migraine before, call your doctor if you're having persistent and intense pain, and they'll talk to you more about the quality of the pain, what brought it on, if there were other symptoms associated with it, what makes it worse, what makes it better, and then decide what your headache is due to. And again, if it is indeed a migraine, they'll tell you what you can take in order to help it feel better. But in a small number of cases, there are more serious underlying problems associated with headaches, and so the doctor will also want to rule those out too. After 20 weeks of pregnancy, the first thing a doctor will consider if a woman is having a headache is preeclampsia. And this is associated with high blood pressure. So the first thing they'll do is test your blood pressure, and if that's normal, then they'll consider other underlying causes, but that has to be ruled out first. Now, of course, we all get headaches every once in a while because we haven't eaten, we need to drink more water, we just didn't get enough sleep, or maybe we're experiencing a tension headache. So, of course, eat and drink and sleep if you feel like those are the causes. And if you feel like it's related to stress, maybe you could go get a prenatal massage if you're pregnant. If you do decide to go get a massage, make sure that the massage therapist knows that you're pregnant and they'll take special precautions. You can also try ice packs and, of course, the medication that your doctor recommends. If you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.